Hello and welcome to Askimo TV. We're talking today to Dr. Haysmith. Dr. Haysmith is an ophthalmic surgeon and clinical lead for macular disease and uveitis at the Luton and Dunstable University Hospital Foundation Trust. Hi, Dr. Haysmith. How are you?
Hi there.
Dr. Haysmith, we're going to talk today about a pretty common condition, conjunctivitis, or people often know it as pink eye. So what is pink eye or conjunctivitis?
Well, the first thing is pink eye is very common, and most people with conjunctivitis probably don't need to see an ophthalmologist because the condition is very frequently self-limiting. There are three types of, or three causes of a pink eye or conjunctivitis. The first is a bacterial infection, which is nearly always characterized by a sticky, pussy discharge from the eye. The second, and probably numerically most common, certainly in Northern European clients, is a viral conjunctivitis, which is typified by a pain and a red eye. And the third is an allergic conjunctivitis, which is typified by a sensation of itch. Both the first two, the bacterial and the viral, are in the vast majority of cases best left untreated, and nature does a wonderful job at causing resolution. In fact, large trials have shown that the use of antibiotics, which is still fairly routine practice amongst most general practitioners, pharmacists, and a large number of ophthalmologists, reduces the course of a bacterial conjunctivitis by half of one day. And these drops can in themselves cause an allergic conjunctivitis because people can be irritated by the pharmaceutical drug itself, or more frequently the preservative that's in the drugs that are bought often over the counter or from a general practitioner.
What are some of the main causes of conjunctivitis, and is it possible to prevent it?
Well, the causes are common infections, and so the typical viral conjunctivitis, which is the numerically most common type of conjunctivitis, often starts actually with a sore throat. And so many patients say that they've had a bit of a flu-like symptoms and the sore throat, and the same virus that's causing the sore throat and the flu-like symptoms can infect the conjunctiva, the outer surface of the eye, and cause the red eye and inflammation of the eye and the sensation of pain and grittiness. You can't really prevent catching these bugs, and these bugs will spread around very quickly through schools, institutions, or around a family. But if you do have it in the family, you can be careful with hand hygiene, making sure that you don't share towels, and that you're not rubbing your eyes with dirty hands. And that will help quite significantly in breaking the chain of infection.
And just to end off, is conjunctivitis contagious?
The first two types that I mentioned, the bacterial and viral, yes, they are contagious. And you shouldn't expose yourself to people who have problems with their immune system, or the very young, or the very old if you have a pink eye. The allergic type of conjunctivitis is not contagious. It's caused by some form of allergen that's in the environment, and very often we struggle to find what the allergen is. But by far the most common is what we call spring conjunctivitis or vernal catarrh, which comes along with the rise in pollen. And I think a lot of people are very common with this. And this can actually be prevented with the use of antihistamines, or can be prevented with the use of drops into the eyes, which help stabilize the mast cells, which are some of the cells that cause the irritation and itch. And these drops can be taken by people who know they're prone to allergic conjunctivitis, seasonal allergic conjunctivitis, before the symptoms actually really get a grip. And with all these things, as is always the case with managing eyes, a stitch in time saves 9. So taking these drops before the symptoms become a major problem is very helpful. There are some unfortunate people with really severe allergic conjunctivitis who need to see an expert, and there are a range of far more potent drugs that are used to control these, but these numbers are small, and most people it's hay fever, and the hay fever can be managed, as I said, with antihistamines or drops.
Thank you, Dr. Haysmith. Thank you so much for talking to me today.
My pleasure.